This is a spot diagnosis, molar pregnancy, and this is a complete mole, complete vesicular mole, because we have what's called partial mole and complete mole. Partial mole in which you find an embryo in addition to the presence, or a fetus in addition to the presence of the molar changes. But in complete mole you will find just the molar changes and there are no fetuses inside. This diagnosis actually is a spot diagnosis by ultrasound, but just you should note how to see that molar changes or how the molar pregnancy appears. And of course immediately evacuation should be done for such pregnancy. And what's very important is the post-evacuation follow-up by serum BHCG tetra follow-up. It should reach 0, and that's very important because she may develop invasive mole, and she may end unfortunately by choriocarcinoma. So this is a very important diagnosis. As you can see here, that was an RVF uterus. This is the urinary bladder up to the left side, but here I'm not focusing on the mole itself. Adding 3D ultrasound actually to this diagnosis would not add a lot, because it's just a spot diagnosed by 2D ultrasound. Even if you are using a portable ultrasound, by any ultrasound you have, any machine, you can diagnose it easily. And as you can see here, of course it's better to be transvaginal ultrasound, but you can see it of course by abdominal ultrasound. Doppler ultrasound will show increased vascularity, of course. As you can see here, the resistance index here reaches 0.49, and of course that's specific, or that's not specific just for molar pregnancy, but for pregnancy as a whole, that there is marked vascularity. Adding 3D ultrasound, as I mentioned, is not necessary, and this is the cervix. If you want to see, this is how the cervix is appearing, and this is the molar changes inside the uterus. This is as you can see, this is the line between the myometrium and the mole itself. So this is the myometrium, but these contents are the molar changes in which you see the snowstorm appearance. The ovaries here were normal, but in many cases you may find fecal lutein cysts, and they are very specific to this molar pregnancy. Of course, adding 3D power Doppler would show you diagnosis, would show you vascularity, marked vascularity, and here after adding glass body appearance, still it's vascular. What's actually very important in cases of invasion, if there is invasion after evacuation and follow-up by ultrasound or even by serum BHCG tetra follow-up, especially if she's receiving chemotherapy. And I'll try to give you in the comments the link to the paper we had about post-evacuation follow-up and how to follow up by Doppler ultrasound in addition to the serum BHCG tetra. Even I can give you that video here for the 3D ultrasound. That's of course after the glass body appearance, 3D ultrasound, 3D power Doppler. But still, as I told you, that this is related directly to the vascularity, and especially if we follow up later, if this case unfortunately turned to invasive mole or choriocarcinoma or something like this, sometimes this is very important in the follow-up of such cases. So please remember how the snowstorm appearance. I try to give you many pictures from many views for this case, just to know how that case appears, because this is a very important and very critical case to be diagnosed as early as you can. And of course the post-evacuation follow-up is very important, as I told you, to guard against change into invasive mole or choriocarcinoma.